Hello, and welcome to One World, One Health, where we take a look at some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as infectious diseases, climate change, and pollution. A One Health approach recognizes that everything on this planet, the animals, plants and people, and the climate and environment are all linked. Drug-resistant germs are winning. Scientists and public health experts call it antimicrobial resistance, the ability to escape the effects of the drugs developed to kill off these bacteria, viruses, and fungi. The World Health Organization, drug companies, researchers, and doctors have been calling the alarm on this problem for decades. Yet, it continues to get worse. As many as 1.3 million people are killed by drug-resistant infections every year. By 2050, that could rise to 10 million people killed every year by drug-resistant infections without urgent action. A third of babies who die as newborns are killed by infections, and more of the germs that cause these infections can resist the effects of drugs. Drug-resistant superbugs can cause urinary tract infections, which affect more than 400 million people a year and kill nearly 250,000 of them. In this episode, we're chatting with Dr. Iruka Okeke, a bacterial geneticist at the University of Ibadan in Nigeria. She teaches in the Department of Pharmaceutical Microbiology and is an expert in how bacteria develop the ability to resist drugs. She's helped write a series of papers in the Lancet medical journal, bringing attention to the problem of antimicrobial resistance. This problem is a big topic of international discussion in 2024, and the Lancet series was put together to help focus that discussion. Iruka, thank you so much for joining us.
Thanks for having me. It's a pleasure to be here and to have the opportunity to talk about antimicrobial resistance.
Well, just how bad is this problem of drug resistance?
Well, it's a huge problem, really. Actually, dwarfs problems that we recognize a lot, like HIV and malaria. That's not to say that those aren't large problems. But the issue with antimicrobial resistance is that it's something that occurs with every single infectious disease. And it's often unrecognized because when people are infected with a pathogen that is antimicrobial resistant, most of what's going around their minds is that they have this disease or that disease, and not necessarily that organism or the germ that is causing that disease is resistant to antimicrobials.
And so you know you're sick, you're getting treatment, but you're not getting better, and you don't know why.
Absolutely. First of all, the treatments are not cheap. So it's a waste of resources to be giving people medicines that won't work. And obviously, every time someone has an infection that isn't treated, the body is being damaged by the organism that causes the disease. So antimicrobial resistance has a lot of costs, physical costs, economic costs, and others.
Who's the most likely to be infected with these drug-resistant germs? Is it the elderly or babies, or who is it?
I think we're all prone to infections, and this is not just humans, actually, even animals. But those who are very young, those who are very old, those who are immunocompromised for some reason or the other, those who are pregnant, are more likely to be infected or more likely to have infections that would not just clear naturally. And so these are the people who are most threatened by antimicrobial resistance.
Where do people catch these infections?
Well, we live among bacteria. There are actually more bacteria than humans everywhere. Most bacteria are normally harmless or always harmless. A few bacteria cause disease all the time, and a few bacteria are what we refer to as opportunistic pathogens, which is that they'll cause disease some of the time. So we can get these infections from our environment, we can get them from other infected people, and we can also get a few pathogens actually transmitted by vectors, by other animals, by insects, and so on. So really, it's difficult to prevent yourself being infected. Luckily, most of us who are healthy can, if we're infected, we can clear those infections without any additional help. But a few of us will need antibiotics.
You talk in this Lancet paper, the series that you were part of, about the need for surveillance. I guess you can't know how bad a problem is if you don't measure it.
Absolutely. Many years ago when I was a student, I heard a health policy person say, if you're playing tennis and you're not keeping score, you're just practicing. If you're doing the real thing, you'll be keeping score. And so if you're really going to be serious about doing something about antimicrobial resistance, we need to know how big the problem is, whether it's getting worse, and whether the things that we do are actually helping. And without surveillance, we can't do any of those things.
And I guess you can't even know what's out there if you're not looking for it.
Absolutely. Yeah. And I mean, the thing about antimicrobial resistance surveillance in particular is that it's not hard to do. It's actually technically easier to do surveillance for antimicrobial resistance compared to COVID surveillance. And during the pandemic, every country had a COVID surveillance program sooner or later. They were using very high-tech molecular techniques to do COVID surveillance. So you can actually just use basic bacteriology techniques and get a lot of information about antimicrobial resistance. And we need every country to be doing that too.
And how can countries do this? Is it a responsibility of individual national governments?
Yes, every Ministry of Health is supposed to have an agency or an office that is responsible for antimicrobial resistance surveillance. And what that office will typically do is collect resistance information from hospitals. So that's one very easy, inexpensive way of doing surveillance because hospitals are already collecting these data to take care of patients. However, I have to admit that when you are doing surveillance only in hospitals, you're biasing yourself to the most sick people. So it's also important to be doing some sort of surveillance in the community and also not among just humans, but also among animals and in the environment.
But are hospitals actually always collecting this information? Even in the U.S., you hear about people who are infected and, the hospital hasn't even bothered to test people for what they've got.
Hospitals are not testing enough. In some parts of the world, they're not testing at all, and this is a huge problem. If you don't have the laboratory facilities, if you don't have the experts who can do it, and importantly, if you don't have the consumables, then it becomes impossible to test people. So we do need to enable hospitals to test people routinely. There's a recent study called the MAP study that was completed recently in Africa that found that actually very, very few African hospitals are doing any testing at all. And most of those that are doing some testing are what you would refer to as tertiary care, referral hospitals. So these are the hospitals that receive patients with the worst infections. And so if we're only getting data from those sorts of institutions, we're not getting a representative look at what the problem of resistance actually is.
So how do countries do more of this? How can they be encouraged? How can they be helped to do more?
I think firstly, recognizing that testing is something that's needed for taking care of patients. And so when countries are building, equipping, and enabling hospitals, they think of doctors and nurses, but they also, in addition, should be thinking of medical lab scientists, microbiologists, as well as the resources that these professionals need to work. That is one thing that is absolutely essential. And then when testing is occurring, the data that comes from those testing needs to be collated. In many hospitals, particularly African hospitals, what happens is a test result is given to a patient and his caregiver on a piece of paper. And so getting that information then to get to the surveillance office in the Ministry of Health becomes nearly impossible. So it's very important for us to digitize records and ensure that the people who are doing the testing are not overworked with recollecting the data and sending it to authorities that might be able to collate it. The third thing I think is that people who are treating patients need to ask for surveillance data. Very often people are making empiric treatment decisions without the information they need. And if they're asking for this data, there will be more of an impetus to generate the information in the first place. And I think everybody who might become ill is a stakeholder in this. If you're going to a hospital and the doctor says, I think you have an infection, then as a patient, it's a good idea to ask, well, please, can I be tested? The doctor will certainly start treating you before the results come out. But then it's good to know if your first antimicrobial course doesn't work, it's good to know what should be used instead.
And as you say, the caregivers need to know because they need to know that something drug resistant might be going around right now.
Absolutely. Some of the most important value of surveillance data and testing data is that when you test a number of patients, when you need to make an empiric decision for the next patient, you can do that in an informed way. You can know that the last 100 patients that came to my hospital that were infected with this pathogen had a resistant infection, so I should be using something else to treat empirically. Or that the last 100 patients had susceptible infections, which means that I don't need to resort to expensive drugs. I can use cheaper drugs.
And you also talk about doing more than just looking at people who are currently ill. Talk about that kind of surveillance.
Absolutely. Where do we get the infections from? Of course, as I mentioned, the bacteria are all around us, but they're also in our food chain. We eat them. They come from animals. They come from our pets. They come from wildlife. And so we really need to know what sorts of organisms, animals around us that may come in contact with humans are carrying and whether they're resistant to antimicrobials, as well as what's in our environment. Now, there are actually inexpensive modules. The WHO has a module known as Tricycle that has inexpensive ways that you can sample not just patients in hospital, but also healthy people by sampling healthy pregnant women who visit hospital from the community regularly, as well as animals that are used for food animals, and the environment, for example, water and wastewater. So if you use a protocol like the Tricycle protocol or something like it, you can have a sense of what resistant organisms are circulating in the environment in which we live, and therefore what sorts of interventions that we need to be able to contain resistance.
Now, environment's a big word, and you talk about environment a lot, but can we describe to people who might not be thinking about it what it means that you might catch this in the environment? It's not just germs floating in the air, right?
Absolutely. And, germs floating in the air is really the least of the problem. They're not that many, certainly not that many that would cause resistance. There's a lot of germs that come out of people and out of animals into our sewage or into where our waste goes if you're living like me in a place where there isn't sewage. So all of those organisms are basically circulating among humans via the environment. And so it's good to know what's out there. And then secondly, water flows into cities via rivers and streams and out of those cities. And so knowing what's in that water is very helpful for understanding what's in the environment. Those are just two examples. There are lots of examples in the literature. For example, wildlife, birds flying in organisms or flying out organisms from a particular place. Essentially, the whole world is a city, and we have to be aware that organisms like people can move from one country to another, and they don't need passports. And so it would be good for us to track them.
Iruka, what got you interested in this field in the first place?
Well, as a graduate student, I was working in a school of pharmacy. There's a lot of work on antimicrobial discovery in pharmacy schools. And I was interested in why we need to discover antimicrobials and realized that antimicrobial resistance, even then, was a problem. I'm very interested in bacteria. If you're not bothered by being sickened by them, they actually look very beautiful in Petri dishes. And so I wanted to be doing something with bacteria. And so when I started working with bacteria, I realized that then bacterial infections were one of the greatest cause of illness and death among children under 5 years old, particularly in African settings where I work. So in addition to enjoying working with the organisms, it became obvious to me that working with these organisms and understanding mechanisms of resistance was very important for protecting children and other vulnerable groups from antimicrobial resistant organisms.
When you were putting together this first paper in the Lancet series, what did you decide to emphasize?
I think one of the take-home messages from paper one is that we've made enormous progress in some areas of infectious disease. For example, children dying before the age of 1. That has dropped substantially due to a number of interventions that have been applied in the last few decades. Unfortunately, we're not making progress in all areas. For example, although deaths of children less than 5 years old are dropping, deaths of neonates, this is newborn children in their first month of life, are remaining stagnant. And that's because many newborns are getting neonatal sepsis, and neonatal sepsis infections these days are often resistant to the antibiotics that can be used to treat that condition. So that's one concern that we have about antimicrobial resistance. Another concern is that we're living to be much older. This is a good thing. I mean, the life expectancy has increased substantially all over the world. But as we live to get older, we become frailer. Our immune systems don't work as well. And so older people tend to be more vulnerable to infections, and then they're more likely to need antibiotics in order to stay alive and also live a productive life. And so we really need to get a handle on antimicrobial resistance for that reason. Another thing is that there's a lot of antimicrobial resistance in infections that should be vaccine preventable. Things like typhoid fever, things like pneumonia caused by Streptococcus pneumoniae. And so, one, we need to track this resistance, but importantly, we need to deploy these vaccines. We need to ensure that everybody has access to them so they don't get infections in the first place, and then they won't need antimicrobials to be treated. And it's very important to understand that resistance is not just a problem in humans. Animals get infection, they get sickened by pathogens, and when these pathogens are resistant to antimicrobials, that's a problem. It increases costs for farmers and then increases the cost of our food. And then this has a knock-on effect on food security. So we have to be thinking about antimicrobial resistance in a very holistic way.
Iruka, thank you so much for chatting with us today.
Thank you. It's been a pleasure.
Listeners, if you enjoyed this podcast, please share it. You can learn more about this podcast and other important topics at onehealthtrust.org. And let us know what else you'd like to hear about at OWOH@onehealthtrust.org. Thanks for joining us.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Laxminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.